A patient of mine sat in a hospital bed 3 weeks after a routine scan, recovering from a surgery he never needed for a problem that was never going to hurt him in the first place. And the strange part is, every single person involved in his care was trying to do the right thing. That's the part nobody tells you. Nobody made a mistake. He simply never knew he was allowed to ask a few simple questions before saying yes. By the end of this video, you will know exactly what those questions are, and you will never walk into a doctor's office feeling powerless again. I want to tell you what happened to him, because in my years of practice, I have seen a version of this story more times than I can count, even when families never connected the dots. He was 74, healthy, active. He played golf twice a week and drove himself everywhere. He went in for a completely unrelated procedure, and as part of the standard pre-op process, he had an imaging scan. The scan found something, a small spot on an organ that had nothing to do with why he was there in the first place. Nobody sat him down and explained what that finding meant in someone his age. Nobody asked him what he wanted to do with that information. The system simply moved forward the way systems do. One appointment led to another. One scan led to a more detailed scan, and eventually, a biopsy. The biopsy showed nothing dangerous. It was, in the language we use, an incidental finding, something that had probably been sitting there for years and would have sat there for years more without ever causing him a single symptom. But getting to that conclusion cost him 6 weeks of fear, a surgical procedure with real recovery time, and a bill that made his wife cry at the kitchen table. I am not telling you this story to make you afraid of doctors. I am telling you this because there is a name for what happened to him, and once you understand it, you will see it everywhere, and more importantly, you will know exactly how to protect yourself and the people you love from it. It is called the cascade effect, and researchers at institutions like the National Institute on Aging have spent years studying exactly how it happens and what helps prevent it. Here is the simple version. A test finds something. That something might be completely harmless, but once it has been found, it cannot be unfound. The next step feels automatic, not because anyone is acting carelessly, but because modern medicine is built to follow up on anything unusual. So a small spot leads to a bigger scan leads to a specialist wanting to be thorough, recommends a procedure, and every single one of those steps carries its own risk, its own cost, and its own toll on your peace of mind. Most of the time, at the end of that road, the answer is reassuring. It was nothing. But you do not get to skip the road to find that out unless you know how to ask the right questions at the very beginning. This is not a video telling you to avoid medical care. Please do not walk away thinking that. Screenings save lives. Early detection saves lives. I believe in that completely, and I recommend it to my own patients every week. What I am going to give you today is something different. It is a set of questions, the same kind doctors ourselves are trained to welcome, that turn you from a passenger into a partner in your own healthcare. The National Institute on Aging publishes guidance exactly like this for older adults, and I am going to walk you through it in plain language, the way I wish more of my colleagues took the time to do in a 12-minute office visit. Before we get into the 5 questions, I want you to understand why this works. There is a well-studied communication model used in clinics across the country called Ask, Share, Know. Researchers tested it directly with patients, and what they found was striking. The people who learned to ask just a small number of specific questions ended up having noticeably better conversations with their doctors. They understood their options more clearly. They felt more involved in decisions about their own bodies. This is not a fringe idea. It is something major health systems actively train doctors to expect and welcome from patients. So if you have ever felt nervous about asking your doctor too many questions, here is something I want you to sit with for a second. A good doctor does not see your questions as a challenge to their judgment. We see them as exactly what a good appointment is supposed to look like. Let's get into the 5 questions. I am going to walk through each one slowly, because the way you ask matters almost as much as what you ask. The first question is this: why is this test being recommended for me specifically? Notice the wording there. Not why is this test recommended in general, but why for you, at your age, with your specific health history. This single question does something powerful. It moves the conversation away from a generic protocol and toward your actual situation. Sometimes the answer will be completely clear and reassuring. Your doctor might say something like, "You have a family history that makes this worth checking," or "You mentioned a symptom last visit that we should follow up on." That is a good, specific answer, and it should put your mind at ease. But sometimes the honest answer is closer to, "It is standard at your age," or "It is part of our usual intake process." That is not a wrong answer. Standard protocols exist for good reasons, but it gives you valuable information. It tells you that this test is about general population guidelines rather than something specific your doctor has noticed about you. And that distinction matters when you get to the next question. The second question is, what will we do differently depending on the result? This is, in my opinion, the single most important question on this entire list, and it is the one almost nobody asks. Think about it this way. If a test comes back abnormal and the plan is to immediately watch and monitor, that is very different information than if an abnormal result would lead straight to a more invasive procedure. If a test comes back normal, does that change your treatment at all? Or were you already planning to do the same thing regardless? I want you to really sit with that question, because here is the truth a lot of people don't realize. Some tests, even when they come back with an unusual result, do not actually change what your doctor would recommend doing next. In cases like that, you are taking on the anxiety, the cost, and sometimes the physical risk of a test for information that will not change your path forward. On the other hand, if your doctor says something like, "If this comes back positive, we would start you on a treatment that has been shown to meaningfully help people in your situation," that is exactly the kind of test worth pursuing. The test is connected to an action. That is what you are listening for. The third question is, what are the possible harms, not just the benefits? We are very used to hearing about the upside of medical tests. Early detection, peace of mind, catching something before it becomes serious. All of that is real and important. But every test and every procedure carries some kind of downside too, and a good doctor will be able to talk you through it honestly. This might be physical risk, like the small chance of complications from an invasive procedure. It might be the risk of a false positive, a result that looks concerning but turns out to be nothing, which can still trigger that whole cascade we talked about earlier. It might simply be the emotional weight of waiting for results, or the financial cost if your insurance does not fully cover it. Asking this question is not about being negative or distrustful. It is about getting the full picture instead of just half of it. The National Institute on Aging specifically encourages older adults to ask their doctor to explain not just what a test will show, but what it might cost you, in every sense of that word. The fourth question is, are there other options, including doing nothing right now and monitoring instead? This question surprises people, because we are taught to think of more testing as automatically being the safer choice. Sometimes it is, but sometimes watchful waiting, meaning checking in again at a future appointment rather than immediately escalating to the next test, is a completely legitimate medical strategy. We use it all the time, especially in older patients, where some conditions move slowly enough that monitoring is genuinely the wiser, lower risk path. Asking about alternatives does not mean you are refusing care. It means you are making sure that the path being suggested is genuinely the best one for you, and not simply the next default step in a long list of standard procedures. The fifth and final question is, how will this test change what I actually do in my daily life? This is the question that brings everything back down to earth, because at the end of the day, the entire point of a medical test is to help you live better, longer if possible, but also fuller, more independent, with more of the things that make life worth living. So ask directly, if this test confirms something, what happens to my daily routine? Will I need new medications? Will there be a recovery period? Will it limit what I can physically do for a while? And just as importantly, if it comes back clear, does anything change at all? This question helps you weigh the test against your actual life, not just against a number on a lab report. Now, I want to be very clear about something, because I do not want this message to be misunderstood. These 5 questions are not a script for refusing care. They are not permission to skip screenings your doctor genuinely recommends. Cancer screenings, blood pressure checks, diabetes monitoring, these save lives every single day, and for many of them, the benefit clearly outweighs the risk. What these questions do is something different and, I think, more valuable. They turn every test into an informed decision instead of an automatic next step. Sometimes you will ask these 5 questions, and your doctor's answers will make you feel completely confident moving forward immediately. That is a wonderful outcome. You walk in informed, you get your answers, and you proceed with total peace of mind. Other times, the answers might lead you and your doctor to a different conversation entirely, maybe about timing, maybe about a different approach. Either outcome is a win, because either way, the decision is now genuinely yours. I think about that patient often when I talk about this. Nobody around him did anything wrong. The doctors were thorough, the hospital followed its protocols correctly, but nobody ever sat him down and asked him what he wanted to know before they moved forward. If he had simply asked, "What will we do differently depending on what this shows?" the conversation that followed might have looked completely different. He is fine now, genuinely fine. But he tells me, every single time a new test gets mentioned to him, he asks his 5 questions first. Not because he distrusts his doctors, because it gives both of us, him and his physician, a clearer, shared understanding of what we are actually doing together. That is really what this comes down to. Modern medicine works best as a partnership. Your doctor brings years of training and clinical judgment. You bring something we cannot have without you, which is the full picture of your own life, your own values, and what matters most to you in the years ahead. 5 simple questions are how you bring that voice into the room. If you found this helpful, the most useful thing you can do is write these 5 questions down or save this video and bring them with you to your very next appointment. And if there is someone in your life, a parent, a spouse, a friend, who tends to go along with whatever is suggested without asking questions, send this to them today. It might be exactly the conversation they need to have with their own doctor. Take care of yourself, ask good questions, and I will see you in the next one.